Hi, everyone. We'll get started in just a minute. As a reminder, you're welcome to hide non-video participants. So there's some other folks behind the scenes on this webinar. You can hide them by going up to the right of their name where the three dots are and click hide non-video participants. And we will get started in just a second. Okay, well, welcome everybody. My name is Jessica Cothran. I'm a marketing manager for UW Medicine, Orthopedic Health, and Sports Medicine. And we have a webinar for you today called Solving Recurrent Ankle Sprains and Instability. We will be posting a recording of this webinar on YouTube, and we'll send out a link by email later this week. Our presenter, as you can see, Dr. Kenneth Chin, he is an orthopedic surgeon with specialized training in foot and ankle surgery. He's also a clinical assistant professor in orthopedics and sports medicine for UW. So Dr. Chin, why don't you get started?
Great. Thank you, Jessica. Thank you for inviting me. And thank you for the privilege of speaking about this topic that's very near and dear to my heart. So we're going to get started. We're going to talk about ankle sprains and instability today. So our objectives today are to talk about some background information about ankle sprains, talk about the typical symptoms patients might experience and how long those symptoms might last, review how we treat these patients, and what to do if you're still having a lot of pain after a bad sprain. So we're going to get into some background information. Ankle sprains are the most common sports injuries. It can be from an athletic injury, a work injury, or a recreational thing. Sometimes it's just a trip and fall around the house. The vast majority of these injuries are an inversion sprain where the foot goes inward, like you see in this soccer player. And this is showing that ankle going inward or inverting. The good news about these ankle sprains are 95% of them will resolve with conservative care. Conservative care being a non-surgical treatment. Like I said, most of the time it's a lateral injury or inversion injury, and that's when the toes are pointed down and the ankle inverts, like in this basketball player up top and the soccer player down in this photograph here. Medial ankle sprains are much less common and are usually a rotational injury. There's over 2 million ankle sprains in the US every year. Historically, over 20,000 ER visits a day in the US alone. And it's definitely the most common sports injury. Almost 50% of all sports injuries are ankle sprains. Now we're going to get into some background about the bony anatomy around the ankle. The ankle is made up of 3 bones. There's the 2 shin bones. The big shin bone is the tibia. The small one is the fibula bone. And in the middle is this talus bone. And the ankle is usually responsible for going up and down. So it's like a hinge joint. So like the action of driving your car, pushing the pedal down. And it hinges at this joint right here. Here again, you can see those 3 main bones of the ankle, the 2 shin bones, the tibia and the fibula, and in red here is the talus bone. And there's a whole truckload of ligaments here. We don't have to know all of them. We're going to focus on the lateral ligaments since those are the ones that are most often injured during an inversion sprain, the most common type of sprain. So the 2 ligaments we're going to focus on are the ATFL, or the anterior talofibular ligament. And that's this one right here. That connects the fibula bone and the talus bone. And the next one is the calcaneofibular ligament, the CFL ligament, here in that circle. And when people sprain their ankle, they sprain either one of the other of these 2 ligaments, or sometimes both. So what is a sprain? A sprain in general is when there's either a stretch, a partial tear, or a full tear of one or more of these ligaments. So a grade 1 sprain is when there's just a stretch of those ligaments. A grade 2 is kind of an intermediate or moderate type of sprain, and that's when there's a partial tear of 1 or 2 of those ligaments. And then a grade 3 is the most severe kind of sprain when there's a complete tear or rupture of those ligaments there. And the symptoms that most people have after a sprain are pain, swelling, swelling mostly on the lateral or outside part of the ankle, some difficulty bearing weight and putting weight on their foot, and also feelings of an unstable ankle, like it's going to give out on them. After we diagnose an ankle sprain, we put the ankle through a recovery, and it's divided up into 3 phases. The first phase is letting the ankle relax and rest and try to reduce the swelling and also protect it from further injury. And this is typically the first week after the injury. And when you see a physician either in the emergency room or the office, they'll usually treat you with, it's an acronym we call RICE. That's rest, ice, compression, and elevation. Anti-inflammatory medications like naproxen or ibuprofen. Immobilizing it in either a brace or a boot just to protect it from further injury and feelings of instability. And depending on how bad it is, we might restrict how much weight you can bear on it. And that's phase 1. Phase 2 involves increasing the range of motion and starting to develop the strength and flexibility. And that's the next couple of weeks. This usually involves physical therapy. And there's some targeted physical therapy exercises that a therapist might work on. That's increasing your range of motion, strengthening, something called proprioception, which is how your brain interprets where your ankle is in space. And also, if you're an athlete or a worker that works on your feet, some specific training on how to get back to your particular activity. Phase 3 is beyond these first few weeks. And that's really the last bit of recovery, getting you back into your particular activity, whether it's sports or work. And so this might involve running, agility, sports training, and really advancing your activities back to normal. And so what's the typical timeline for these injuries? If they're more mild sprains, a grade 1 sprain, symptoms might only last 1 week. A grade 2, greater than 2 weeks. The more severe ones, like grade 3 sprains, can be up to 3 to 4 months. If there is bone bruising that we identify, sometimes the symptoms can last even longer, up to 6 months. So almost half of these patients can experience symptoms for up to 6 months. That might involve swelling or pain or instability. The most common symptoms people have are swelling. Swelling is one of the last things to go away. And some people can have swelling up to 6 months after the injury. And there are a small portion of these patients, 5 to 10% of them, that will have persistent symptoms. So, persistent symptoms after an ankle sprain, why does it hurt? It's been 4 or 6 weeks after the sprain, it's still really hurting a lot. I'm having difficulty progressing my activity. That's when you'd want to see an orthopedic specialist to get it checked out. Most common symptoms people have after the initial recovery might be pain, instability, the feeling that the ankle is going to give out on them, the feeling of catching or locking. That's when the ankle joint might lock up and get stuck in place. And you might have to jiggle it loose or use your hands to actually manipulate it to get it to move again. Stiffness, where you don't have the full range of motion of that joint. And swelling, like I talked about, swelling can last up to 6 months after this type of injury, especially a severe sprain like a grade 3. So what can be causing this? In some cases, it's just maybe you didn't have the right kind of rehabilitation. Maybe you didn't have the proper physical therapy or never even saw a physical therapist. That can be the cause of things. It might be something else going on. It might be a different type of trauma. It might not just be an ankle sprain. It's possible that it could be an injury to one of the bones, like a fracture or break of the bone. Ankle impingement is when there's a loss of range of motion. due to something getting stuck in the joint. And we'll review each of these together. It's cartilage injuries and also persistent ankle instability. So improper rehab. So rehab is really important. And one thing that we really use during physical therapy is something called functional ankle rehabilitation. And all the studies we've done shows that the proper rehab is more important than immobilizing it. So really getting in to see a physical therapist and going through all the steps of recovery is really important. And a lot of patients come in with persistent pain and swelling and never saw a physical therapist. And that's a really important step to rehabbing these things. In cases of improper rehab, we usually get them referred to a good physical therapist so they can get on the road to recovery. There's also the cases of undetected trauma. That's when people think that they just had they just had an ankle sprain, things aren't getting any better, then they see a specialist, they get some x-rays and figure out there's something else going on. Maybe it wasn't just an ankle sprain. It's possible that you could have fractured a piece of the talus bone, or it might not even be there. It might be a part of the heel bone, the calcaneus. Here in this lower picture, you see that little corner of the calcaneus bone is fractured. The cuboid's the next door neighbor bone, or it's even possible to fracture the fifth metatarsal base. And the way we would diagnose this is with a good physical exam and a set of x-rays. And depending on what type of fracture it is, it will determine the treatment. Here's a picture of someone who had a talus fracture, who initially thought it was just a sprain. Ankle impingement. So ankle impingement is when there's chronic inflammation of the joint lining. All of our joints are lined with something called synovium. That's a fancy word for the joint lining. And sometimes there could be inflammation within the joint. And impingement is when that little piece of tissue can get caught in the joint and cause pain. And that could either be the soft tissue of the joint lining or from small bone spurs. Here on this lower picture of this MRI, you can see this bone spurs where the arrows are pointing at. And when the patient is trying to go through range of motion, those little bone spurs are bumping into each other. The treatment for this is either conservative things like physical therapy, bracing, or a cortisone injection. And as a last resort, surgery is usually an arthroscopic procedure to either remove those bone spurs or to shave out that inflammation of the joint lining. It's also possible that patients can have a cartilage injury when they sprain their ankle. We call that an osteochondral defect. Osteo means bone and chondral means cartilage, so it's a bone and cartilage injury. And that can occur up to 2 to 6% of ankle sprains. So cartilage is the smooth bearing surface of all of our joints. It's a really slick surface that lets all our joints glide smoothly, in all our joints, in our ankle, our knees, our elbow, and in our neck joints. There's this really slick surface that lets things glide smoothly. And sometimes you can have an injury to that cartilage. And so I like to think of this as being kind of like a pothole in cartilage. Cartilage is usually a smooth surface. And after we get an MRI and an X-ray, if we just think it's a osteochondral or cartilage injury, we might treat it with surgery. And in surgery, we get to see that little pothole. And this is what it looks like arthroscopically. Arthroscopically is when we go into the joint with a little camera. And this is that little pothole that I was talking about. In the background of this picture, you can kind of see that smooth surface of that joint. That's what smooth cartilage should look like. And an injured cartilage looks like this. There's a little pothole causing pain and snagging. Initially, we try to treat these conservatively, just like everything else, with immobilization, physical therapy. But if that fails, then we could always consider surgery, where we look at these things arthroscopically and clean them out. And in some cases, we have to do cartilage grafting. And lastly, what do we do with patients who have persistent instability? After a sprain, like we talked about, you either stretch or tear those ligaments. Usually what happens is those ligaments will scar in and provide stability by scarring in and creating a new ligament. But in some patients, those ligaments either heal in a stretched out position or they never heal at all, and they have persistent instability. And these symptoms might be something where they're walking along and they feel like the ankle's given out, even walking in a straight line, or sometimes only with pivoting type sports like soccer, football or basketball. And this is instability that occurs despite having a full course of conservative treatment with bracing, physical therapy, and taping. And so if we think it's ankle instability, we'll do these specialized physical exam tests. And this first one is called the anterior drawer, where we actually test the stability of that ATFL ligament. That's when we pull the foot forward to see how stable it is. Sometimes we'll even do it under X-ray guidance, and we can see the bone shifting around actually. And here you can see how the foot bone, the talus bone, is shifting forward while we do this physical exam test. There's another physical exam that we might do, and this is called an inversion test, where we tilt the foot in, and we're testing the competence of those ligaments again. And we'll also do this on X-ray sometimes. And here you can see that talus bone, that bone tilting inward, demonstrating how incompetent that ligament is, whether it healed in a stretched out position or if it never healed at all. In these cases, if physical therapy has failed and patients still have instability, we'll consider surgically stabilizing these things. And what we'll usually do in most cases is we'll repair those native ATFL and TFL ligaments. If it hasn't healed, we'll sew them back together, or if it's healed in a stretched out position, we'll tighten them up. And that's something called a Brostrom-Gould procedure. In some cases where there might be a revision surgery, or if there's really a great amount of instability, we might augment it with suture, which is a really strong type of stitch. And in some of the really worst cases, we might have to use a cadaver graft to rebuild that ligament. So I just went through a whole slew of information as well as problems that might arise after an ankle sprain. The question is, when should I see an orthopedist? And what you might want to look for is if there's severe joint tenderness or swelling, it might be a sign that something more might be going on. Maybe it's a bone fracture. So that's something where you might want to see a specialist. If you've gone through physical therapy and you use a brace and you still have sprains or instability, maybe those ligaments didn't heal right. The physical therapy, you went through months and months of physical therapy and it still doesn't quite feel right. So those, to me, are the three biggest reasons to see an orthopedist. So now we can move on to the Q&A process. So the first question I have is, what causes your foot to be cold after a sprain or a break? Usually that's a decrease in the circulation you have in your ankle. You're not using it as much, and your body's just not pumping as much blood to that ankle, so it can feel cold. Another question I had was, is it ever too late to start physical therapy? And I would say it's never late to start physical therapy. Physical therapy is really important to rehab the surrounding muscles and can really strengthen things, and it can help patients recover, even if it's an injury from 5-10 years ago. We had a couple other questions that were sent to me prior to the talk. The first one is, after an ankle injury and seeking treatment, does the ankle ever go back to its previous uninjured form ever? So in some cases, like we talked about, when there's an ankle sprain, the ligament either stretches or tears, and most of the time it scars in and the body's able to heal it on its own. But if those things don't heal together, or if the ankle ligaments are too stretched out and people have persistent instability, then it might be a case where we have to consider surgically repairing those ligaments. Another question that I got prior to the talk was, does arthritis from an ankle injury contribute to instability? I would actually say it's the other way around. And patients who have persistent instability, where their ankle gives out on them a lot, it can actually cause arthritis from the bone shifting around. Another question, this is from a runner. For a runner with ankle instability and injuries, what type of running shoes do you recommend? So what you're looking for is you're going to want to look for something supportive. And what that means is you want to find a shoe that doesn't bend much. So if you go into the running store and you see one of those new age running shoes, then you can roll it up and put it in your pocket because they're super flexible. That's not what you're looking for. You want to find a shoe that's more rigid, that doesn't flex as much. And some of the brands that are really good and have supportive models are Brooks, Saucony, and New Balance. There was a question about ankle sprains in kids. How can I help elementary age children who report ankle pain several times per year? So one thing I've seen with kids is I personally have a 3-year-old and they are crazy. They kind of wear shoes that might not be appropriate. My daughter, who's 3 years old, will love to run in these rubber rain boots year round. They have no support. They're all flimsy. So the first thing to do is to get them good supportive shoes so they're not running around in rain boots in July or wearing flip-flops. Another question is how to deal with chronic pain following a bad sprain. And, if you're still having bad pain after a sprain, might be something where you need to see a specialist, whether it's an orthopedic specialist or a physical therapist. Another question is what ankle strengthening exercises do you recommend? So what I'll do is I will share a link to some of the exercises that the AAOS recommends. The AAOS is the governing body over the American Orthopedic Surgeons, and they have a list of recommended exercises that I can share with everybody. So I'll throw that in the chat right now. Sorry, I don't have that link. Tammy or Jessica, do you have that link? Can you put that in the chat? I had a question about pronation. So is there a relation between overpronation in runners and ankle instability? So actually pronation is a type of foot posture when the foot is, instead of tilting inward or neutral, the feet are tilted outward. And actually patients or runners who overpronate actually protect against instability. By rolling their foot outward, they actually have a lower risk of developing ankle sprains. I had a question about, I have an old ankle sprain that never healed after years. What are the options to make it more stable and reduce pain when exercising? This is the kind of thing where if you're still having instability, it might be something where you need to see a specialist and talk more about having a surgical discussion about repairing those ligaments. All right, and then let's see here. We had a couple more questions asked today. What would be the steps to heal a closed avulsion fracture to the distal fibula? Does it require surgery typically? So the good news is that avulsion fractures typically heal pretty well on their own. Now, an avulsion fracture is when instead of the ligament tearing, it actually pulls a little piece of bone off the fibula bone. So you can think about it like a really bad sprain. And this almost never requires surgery. You typically heal in place, but sometimes if they don't heal, you might have to reattach the ligament down to the bone with surgery. But we just treat that like a bad sprain. Another question, can ankles become unstable just due to age, not injury? Yes. So there's a lot that's involved with instability. The main ligaments, the ATFL and CFL ligaments, those are the ligaments that stabilize the ankle, but there's also tendons around that area, and tendons also help to stabilize the ankle as well. And what happens is, as some patients age, those tendons might get weaker and provide less stability to that joint. All right, here's a question. I've seen a podiatrist and they recommended an MRI after a prolonged ankle injury. Should I do that before seeing an orthopedist or see the orthopedist first? I would say if you saw a doctor and they recommended an MRI, it's a good idea to get that MRI first before seeing the orthopedist. Having that MRI is something the orthopedist is probably going to get anyway, so having more information up front is a good idea. I have a question about tibial overuse injury. If you have a tibial overuse injury in your ankle and have done physical therapy, will it ever be stable again? So there's different types of tibial overuse injuries. It might be a stress fracture or it could be shin splints. Usually neither one of those directly cause instability of the ankle. So it might be something where you need to see a specialist to really get to the bottom of it. Okay, so we kind of zipped through all the Q&As there. I zipped through the presentation pretty quickly, and we still have plenty of time for other questions. I have my contact information here. I see patients in 3 locations. My first location is in that University of Washington Sports Medicine Clinic at Husky Stadium. That's near the Montlake campus. And at Northwest Hospital, there's 2 locations, one in Ballard and another one in Northgate. I see we have a couple of more questions here. Would you be able to address ankle replacement surgery? Ankle replacement surgery is something quite different than ankle stability. Now, the reason we usually do an ankle replacement is if there's severe arthritis in the ankle joint. Just like in the knee and hip, that's way more common to have hip or knee arthritis. And you probably know someone, whether it's a friend or family, that had a hip or knee replacement. They also make ankle replacements too. And that's when we replace an arthritic ankle with metal and plastic parts to restore the joint. And that's something we consider when patients have a lot of pain and dysfunction with a wear and tear of that joint. But it's occasionally related to ankle instability, but usually it's a separate type of problem. I had another question about if I needed ankle surgery, how long should I expect to remain in the hospital after surgery? How long would it take to recover? And what would you say to expect during recovery time? So it really depends on what type of ankle surgery you need. If the main topic of this talk was ankle stabilization. So if you had an ankle stabilizing surgery, we called it the Brostrom surgery, where we repair those ligaments back. It's usually an outpatient surgery. You come and go the same day. The surgery itself takes about an hour and a half. But you do not need to stay in the hospital after surgery. You go home the same day. The full recovery is up to a whole year. And that really the reason why is during that time of recovery, your leg's going to get really weak. So it takes up to a whole year to rebuild your strength and endurance. But in the short term, patients are non-weight bearing for a couple weeks. Usually it's 4 weeks of no walking on it, whether you're using a set of crutches or a wheelchair or one of those knee scooters. 4 weeks of no walking on it, and then another 4 weeks of walking in one of those boots. And then we start physical therapy. Most people are starting to run at around 4 to 6 months. But like I said, the full recovery time up to 1 year. I had another question about how long before a bone bruise above the ankle is gone. Could the bruise affect my ankle later? So usually when people sprain their ankle, they stretch out those ligaments or tear the ligaments, but in some cases, patients can bruise the bone. Now, most of the bruises we experience is if we fall and get a black and blue of our elbow or knee, but you can actually bruise the bone itself. And bone bruising that you might see on an MRI will take way longer to heal than ligament injury. And it can last up to between 6 and 12 months. So it could really take a lot longer to heal compared to a regular garden variety ankle sprain. Could the bruise affect my ankle later? Unlikely. After the bruise heals, it should not have any sort of long-term effect on the ankle. I think Tammy and Jessica were able to post the link to the strengthening exercises. So please feel free to click on that and save that as a favorite or print it out.
Well, thank you, Dr. Chin, and thank you to everyone who posted such great questions. We will be posting a recording of this webinar to YouTube, and we'll send out a link by email later this week. And as you can see on the screen, we still have Dr. Chin's clinic contact information. You can also learn more about our programs and our doctors at uwmedicine.org/joint health.
Thank you,
Well,
Jessica.
thank you so
Thank you
much.
for attending.
Great. Thank you, everyone. Have a wonderful day.